Hi, my name is Dr. Lucy Meier from Third Coast Foot and Ankle. And today we're going to address those activities that you should and shouldn't be doing when you're struggling with plantar fasciitis or heel pain. Now, I like to tell my patients, I don't want you to be a couch potato when you have plantar fasciitis, because if you're sitting around doing nothing, as you may already be experiencing, you have no pain. But that doesn't mean as soon as you become active and start to increase your activity that ligament is still having a hard time holding its integrity. And so oftentimes that just pure rest will make you feel good, but it isn't necessarily recovering the ligament appropriately. So I want us to focus on decreasing our activity and focusing on activities that are not going to further injure that plantar fascia. And so let's start with the basics. So if you are somebody who is already on a routine workout plan, routine walking or running program, your best bet is to decrease your intensity and decrease the amount of time that you're doing it. So give yourself some limitations. Oftentimes, we feel pretty good when we're doing the activity. It's after or an hour later after we've rested that our pain will increase. And so we really have to be prepared with the idea that we're going to go into this with decreasing our activity or decreasing the intensity of our activity and then sticking to that plan. Now, there are certain types of activities that can aggravate that fascia. Now, the thing we can equate it to is the flexion of our big toe, which is not where we're having pain, but when we push our big toe up and we push off the front of our foot, that actually puts a lot of tension on that ligament that is injured, the plantar fascia. And so we want to decrease activities where we're having high impact or high force across that. Now, some of you might be thinking, well, that's running and walking. Yes, that's why we're decreasing our intensity and we're decreasing our time, but we're also going to think a little bit more closely about what we're wearing when we're doing those activities, but also what we're doing those activities on. And so running or walking on an incline, so if you do this on a treadmill or outside, if you have a lot of hills or if you're coming up on an incline, it actually increases how much range of motion you're having on that big toe joint, which subsequently puts more stress on that plantar fascia. Now let's also talk about the shoes that you're using. If you're using a really flat shoe that doesn't have much of a rocker to it, so if you're not using like a true walking or running shoe, I actually prefer a running shoe more than anything else when we're having plantar fasciitis, because that's naturally just going to propel you forward or propel your foot and body forward to some degree. I know you won't necessarily feel like you're teeter-tottering, but from a biomechanical standpoint, it's going to put less stress on that plantar fascia when you're doing such activities. Now, let's get to some nitty-gritty stuff too. So some yoga poses. Now, I want you to stretch your I want you to stretch your calf muscles. And so a lot of people will do downward dog to do such a thing, which is a very effective stretch, but it can also put some extra stress on that plantar fascia. So it's better to stretch your calf muscle with your foot completely flat, right? We don't want to necessarily come up onto our tippy toes in order to get that stretch in the calf muscle, because we'll also strain that plantar fascia. Lunges can be okay to do if we are lunging forward. A reverse lunge, you end up putting all of the weight onto your ball of your foot, which increases the flexion of that big toe joint, which then pulls on that plantar fascia. And so if you are going to do a leg workout, you're going to really want to focus on those exercises where you're putting the weight into your heels. I know that seems counterproductive because your heel is what hurts, but by putting the weight into the heel, like doing a basic squat, you're actually keeping your foot very, very flat, and that pressure is evenly distributed more across the foot, and therefore less likely to overstrain or injure that plantar fascia. Now, there's other things that you can kind of just in your brain start to focus on. If you're somebody who does an elliptical, when you get tired, we tend to really start to lean forward, and maybe you come up on the ball of your foot and you're not necessarily pushing those pedals down with a flat foot. We want to avoid fatigued exercise. You want to make sure that if you're going to start limiting your time or intensity, that the exercises that you're doing are very effective and not injury prone. Fatigued exercises tend to cause us to lose form and put us at a much more vulnerable state. Now, this is not forever. This is a short change in your program in order to get yourself back on track in a safe way to increase that intensity and increase that exercise routine as fast as possible. But we do have to put the time in, not to stop. We're not going to be couch potatoes, but to really monitor what and how we're doing so this can heal appropriately. Now, if you found this really helpful, or if you want more advice on your specific workout plan and what you should and shouldn't be doing, please feel free to call our office and schedule an appointment with me. I love these types of consultations to really help our athletes, or even just our active people, continuing to stay active, because your health is so important, and we treat the whole body, not just the foot. So if this was very helpful for you, I would so appreciate it if you press the like button, because that helps me a lot too. I hope you have a great day. And once again, I'm Dr. Lucy Meier from Third Coast Foot and Ankle.